well, in spite of the rainy day, we have a large crowd. Obviously, this is an important issue to people. There we are. Let's see what we got here now. Great crowd, and we even have some entertainment up here.
Places in Canada spends $100 less per person for health care in Ontario. You multiply that times the number of people that live here, that's well over $1.2 billion that we are being shortfalled in this province for health care. So I say shame on the federal government for what they're doing right now, not giving Ontario what they deserve. We're one of the richest provinces in this country, and yet we don't have the same health care. And our provincial government keeps saying, well, we have money for the LHINs. Well, what does that do for your health care? Oh, and we have money to build private hospitals and give profits to P3 owners, don't we? Yeah, we seem to have money for that. But do we have money for our public system, our emerges, our ORs, our surgery departments, our laboratories? No, we don't. And I say shame. Keep telling us that the privates are the answer. Well, we know the answer to that. We have the emergency department over here. We have the surgery that at Central Hospital. The Central Hospital is losing its surgery department to a private company. Laboratories. Did you know if you go to a private lab, the work costs approximately $22 per person? and it's half of that if you do it in a hospital. So I say, what are you doing with the money? The speaker before said to you, our money is not being put into the hands of the sick people and the people who look after them, and that's what this is about. It's time to realize the Romano dream. And the Romano dream was more public care. It was about non-profit long-term care. We only have about 10%, so please make a difference. Get involved. Talk to 10 people. I'll talk to 10 people, and we'll make change. Thank you.
Nurses know that health and healthy communities are impossible while more and more families and more children live under the shameful shroud of poverty. We are dismayed, indeed we should be shamed, that more than 1.7 million people live in poverty in Ontario. Their hopes for a better life were shattered last week when our Premier said, given the state of the economy, it may very well mean that we won't be able to move as quickly as we would have liked or as we had originally intended. In government, we have to act responsibly in the same way that our families do if finances get tight. Premier, poverty is a priority, and nurses from around this province are here today to tell you that there is no time to wait. The evidence is clear. Differences in social and economic status are directly linked to unequal health outcomes. Poverty, inadequate housing, social exclusion, barriers to health care are among the main social causes of ill health. We are acutely aware that our clients living in poverty struggle every day, every single day, to meet their basic needs for food and shelter. Academic research and our own practice confirms that poverty harms health and puts people at greater risk of death throughout their lives. Premier, we are here to demand that you deliver on your promise of leaving no one behind. The time for action is now. Start with the principle that a fair day's work equals a fair day's pay. Through minimum wage increases, stepped up enforcement of labor standards, and breaking down the barriers based on discrimination. Give adults and children real income security by bolstering the newly created Ontario Child Care Benefit and providing adequate support for those who cannot work full-time. Include policies that address the disproportionate effect of poverty on Aboriginal people, women, persons with disabilities, racialized communities, and newcomers to our country. Make affordable housing and quality child care top priorities, and ensure that every one of us has real access to medical and dental care. Premier McGinty, we look to you for leadership to deliver and implement now, a comprehensive poverty strategy. And there's one more thing, Mr. Premier. You may have noticed that there's a federal election going on. It is the people who live in poverty who need a champion to make sure poverty and health are part of that federal election debate. They are the people who really need equalization. Premier McGinty, we need you to stand up for Ontarians living in poverty here in Ontario. Hold to the fire the feet of every federal candidate. And to all of you, my friends, I say, vote on October 14th, but vote for health, healthy communities, and strong, public, one-tier, not-for-profit health care. Thank you for the chance.